but asked me to share with you all that he is dealing with just some family things right now. One sad thing in that his wife's family home was tragically lost in the Sonoma fires yesterday. And then one happy thing in that they are having a grandbaby delivered via C-section early tomorrow morning. So his focus is on his family tonight, and he sends his regrets. Just a little bit of background. Again, really pleased to be here this evening. One of the things that we recognize is that there's a lot of attention around COVID, not only in our community, but certainly in other parts of the state and the country. And we have heard a lot about our neighbors, Boulder, and some of the things that CU has been experiencing, as well as other campuses across the country. While we are not in a position right now that we have that level of concern, we're very fortunate that things are in pretty good shape, as you will hear from Tom and President McConnell. We're constantly monitoring and ready to adapt to those changes as we need to. And, one of the things that I really think is special about our community is that we have very strong partnerships. And so part of what I hope that you will hear tonight and take away is just the strong level of coordination, cooperation, and really true partnership that exists between Colorado State University, between Larimer County and the city of Fort Collins, as well as many others in our community. Today we really wanted to just give you a bit of an overview and talk about our plans, what we have in place, and let you all as a community know that we have a very shared value toward openness and transparency. And so if things begin to change or we need to have more frequent communication with the community, we're prepared and ready to do that. So again, I want to welcome my fellow partners here and say how much we appreciate the time and you sharing with the community. And I'm going to go ahead and turn it over to Tom Gonzalez to talk just a little bit about the overall health of the community and how the county specifically is advising and working with the university. So Tom, thanks for being here. And Tom, I may be the only one who can't hear you, but I'm...
My apologies. Good evening. Thank you, Kelly, and good evening, everyone, and thanks for attending this town hall. My name is Tom Gonzalez, Public Health Director for Larimer County. Just a little background of where we're at in the level, if you all maybe have heard the Colorado COVID dial. Currently, Larimer County is assigned to Safer at Home Level 1 phase. There are 5 levels within the Colorado COVID dial. The first or least restrictive is Protect Our Neighbor. And then Safer at Home Level 1, which we are at. Then there's Level 2, 3, and then Stay at Home. These levels are assigned to us from the state based on metrics they determine. And there's 3 primary metrics that we're following. Now there's a lot of data on our dashboard, but they kind of filter down to 3 major metrics we are always watching daily. One is the positivity rates of our tests. Ours is lower than the state's requirement of 5%. Currently, our 14-day is at 2.2%, and that's just extremely low. And overall, since our first case on March 9th, we're at 3.3%. This is due to our robust testing capacity in Larimer County and at Colorado State University, and that helps our positivity rate continue to stay low. And it gives an opportunity for those close contacts to be tested and make sure that we're doing robust contact tracing. One is our decreasing or stable hospitalization. That's another matrix, the hospitalizations. Ours continues to stay steady or decline. Our hospitals with UC Health, Banner, and Kaiser have done a great job treating cases, and many are not as sick right now or not requiring as much long-term care as back in March and April. This is primarily based on the age ranges we are currently seeing, and I'll talk a little bit more about that. The third matrix is the 14-day case count per 100,000. Unfortunately, this is where we are falling a bit short, at least in the last 2 weeks. We're seeing cases rise again, and as they are across the state and many other states in the United States. One primary age range we are seeing increases are 18 to 24-year-olds. And we are working closely with Colorado State University and Front Range Community College to work on getting our cases back down related to that age range. While there is an increase in cases for that age range, we still have cases from other age ranges as well, and those also continue to rise ever so slightly. If we are transitioning to a new level, we unfortunately would be moving to safer at home level 2, the opposite direction of where we want to go. Therefore, we need to wear our face coverings and continue our social distancing and hand washing and no large gatherings. We have to work harder to get our cases down to keep us at the safer at home level status and achieve our next goal to meet protect our neighbors status. And I understand we are tired of all these restrictions, but lowering our guard now may lead to more illness and a rollback to level 2. Now, speaking of protect our neighbor, we have talked to the state about moving to protect our neighbor with the good work we're doing. They are saying we must be down to 50 cases per 100,000, and we're running right at about 100 cases per 100,000, and that's over a 14-day mark. We are not near that yet, but are planning to apply as soon as we get close. We are working on meeting with mayors, police chiefs, as they will also need to provide individual letters to show they will support and enforce public health orders in order to move forward. We are working on a containment plan so it is ready to go when we get close. Containment plan includes sufficient personal protective equipment, or PPE. Local hospitals must have 2 weeks of PPE available based on current use standards. We meet that right now. Fewer new cases. Unfortunately, that's the one we need to really target. A documented surge capacity plan for case investigation and contact tracing. We have that, and we're doing very well there. And documented strategies to offer testing to close contacts. And here in Larimer County, we meet that. I tell people back in March, we could barely get 30 COVID tests in the whole county. With our partnerships with UC Health, Banner, Kaiser, Salute, and our community-wide testing Tuesday, Wednesday, and Friday in both Fort Collins and Loveland, we can offer up to 1,500 tests almost every day of the week. That is a tribute to the partnership and collaboration we have in Larimer County. And when you include the testing that's going on at Colorado State University, which President McConnell will talk about, we can even do more testing. And that is important as we move forward to protect our neighbor. Now, we want to get to protect our neighbor, and we need everyone to do their part to help us get there. And it's important that our partnerships, and a big partnership with Colorado State University has been in place since the beginning of this pandemic. And our teams work closely together daily. They work closely together. We have integrated contact tracing teams, and our health department staff are available to help do assessments and jump in with case questions. And we work together to provide robust testing, as I mentioned. Our contact tracers are assigned to both Colorado State University and Front Range Community College, as well as our K-12 schools. We know we are fortunate to have a close working relationship with CSU, and that has made the biggest difference in our response related to the 18 to 24 age range in Larimer County. And with that, Kelly, I'll turn it back to you.
All right, thank you very much. I believe at this point we are going to focus specifically on our CSU partner and turn it over to Dr. McConnell to share some insights with us. So Dr. McConnell, thanks for being here.
Thank you so much, Kelly, and thank you everyone for including Colorado State University in this town hall. I think it really speaks to our strong partnership with the city and the county. And Tom Gonzalez told you a little bit about that already, but I think it's worth repeating that CSU and county health are in touch every day, if not multiple times a day. And we share a lot of resources, including contact tracing and testing. So I want to thank the county for everything they've done to be just tremendous partners with us from the very beginning. The most important thing I think for everyone to understand about Colorado State University is that there's nothing more important to us than protecting the health, and that's of everyone, both on campus and off campus. We take our relationship and our responsibility to the community very seriously, and that's one of the reasons that we've had such robust testing. I think it will surprise everyone to know that since August 17th, we have already done 18,700 tests. Of those 18,700 tests, we've had 186 positive cases for a 1.2% prevalence rate, which, as you heard from Tom, is on the lower end. And we have been able to keep it, I believe, at the lower end because of how quickly we've been able to not only test, but to contact trace, to quarantine those who are contacts or close contacts, and to isolate anyone who is positive. So we've been able to have a very rapid response. And I think that that is why we've been able to stay at the 1.2% rate of infection for everyone who's been tested through CSU. I know that people in the community are concerned, as Tom has pointed out. The largest increase in cases is in the age group of college-age students and slightly beyond, so 18 to 24. So our young adult population in the county and in the city, whether they're CSU students or not, are where we're seeing the greatest increase. What I want to assure everyone of is that for those 18 to 24-year-olds who are CSU students, our protocols for testing, contact tracing, quarantine, and isolation are incredibly rigorous. And so the 18 to 24-year-olds that are our students are being very well monitored and cared for in the community. And I think that's important for everyone to know. The other thing I want everyone to know is that our students really want to be on campus. And so because they want to be on campus, they're working very hard. And I would say 90%, if not more, of our students are following every strict protocol that we've put in place. And I think that's important for everyone to know. And if you come on campus, you'll see students wearing their masks. The other thing that we're very proud of is that the transmission that we've seen through and contact tracing has led us to see that it's gatherings that are mostly where the sites of transmission are. We've actually seen no transmission in our classrooms. And I think that that's very, very important for the community to hear, that all of our sanitizing and mask wearing and physical distancing is making a huge difference in how we've been able to mitigate the transmission. We're working very, very hard with our students. We know that we do have some students, and as I said, I think it's a small percentage, but we have some students who are not adhering to protocols. But what I want to assure everyone of is that we have policies in place, including that violations of university protocols as well as any city or county protocols fall under student misconduct. And we're taking action whenever we can to make sure that students who are not adhering or who are flouting the protocols, that we're taking action. And then on the positive side, we have a very robust social norming campaign where we're constantly in contact with our students, reminding them of what needs to be done. I know that everyone is not familiar with getting on the CSU website, but I want to remind everyone, if you haven't already, that CSU posts a dashboard with updates on our COVID-19 website. So if you're ever curious about what's going on campus, you can go to that website. And in addition, you'll see all of our protocols are there and available for anyone who wants to be able to read in more detail what it is that we're doing. Do want to reassure everyone that we do take this very seriously, and we've invested more than $2 million to date in testing and in contact tracing, and we will continue to invest. We're also doing a very campus-wide flu vaccination program so that we're going to be able to keep our students safe from flu as well, which I think is very, very important, not just in controlling flu transmission, but in being able to clarify when something is the flu versus when something is COVID-19. So being able to separate those out is very, very important to how we monitor health on campus. Our CSU Public Health Office has the same authority as Larimer County to isolate individuals who do test positive. And we follow all of the Larimer County guidelines and the CDC and state guidelines. I want to assure everyone of that. Finally, I just want to note that we have an amazing team, and I have two of the members of our pandemic preparedness team here with me this evening. And so I'm going to ask Mary Pedersen, who is our provost and executive vice president, to add some additional information that are specifics about our testing protocols. Mary?
Thank you, Joyce. And it's a real pleasure to join all of you this evening and share a little bit more updated information. I think one thing that is really extremely unique and special about CSU is the amount of research that we have on our campus. We were rated in the top 10 universities in the country for COVID research, and we actually ranked number 4, and we have over 24 different research labs and projects and focusing on different aspects of COVID research, including providing support in the many of the senior care facilities around Colorado. We have projects working on sanitation and disinfectants. We have a couple of actual vaccines that are ready to go into phase 3 clinical trials soon. And we also have new testing protocols. So one of the things that we have been doing is we have been trying to develop a very aggressive early intervention testing program. And as you've probably heard, testing is one of the criteria that is used to stay on top of the COVID pandemic in terms of having adequate testing. And testing, contact tracing, quarantine, and isolation are one of the key areas. And so one of our approaches has been to have very aggressive early testing and to use some early research data that indicates where we may need to really focus on our testing. And that's the wastewater data that our researchers on our campus have been exploring. The wastewater data, we are really only one of a few handful of universities that is using what's called a micro-surveillance approach. And the wastewater approach uses the concept that individuals who are exposed and then coming down with COVID virus will shed. The earliest shedding will occur in the fecal matter. So if we monitor for that many times will actually show up earlier than a positive result testing for COVID. So we've used this principle and we're really testing it out. We have 17 different manhole sites that reflect different buildings on campus. We are testing now 3 times a week. And so we have a regular cadence and we look at the wastewater data, which is a collection over a period of time that reflects that building. And so we've been using that to guide our testing in a very strategic manner. So we have focused on different residence halls. If we've seen values go up, we will do a little bit more aggressive surveillance testing on those dorms. We've actually pretty much right now put all of our residence halls on a cycle of testing guided by where we need to focus on initially. And we have gone in and messaged the students and requested them to all go for testing over usually a 2-day period. And so this has been extremely valuable in helping us to identify positive cases, move them into isolation, follow up the close contacts, and put them in quarantine. And so our team has been meeting daily. We actually meet 3 times a day looking at our data. We look at the data every single day, and we've been using this to really guide what happens over the next day or two. And so it has been quite an intensive program to actually focus on the testing. And so there's no roadmap for how to do this because this is such a new science and there's not published papers out there. So we are really using the response to these signals as a very early detection. So that's why we actually had decided to select 2 of our residence halls to put the entire residence halls on quarantine until we could have all of the individuals go through testing so that we could identify the positive cases and remove them. And so that has really been part of our strategy. So in addition to the testing protocols, we have a new test that we are going to be rolling out in the next week or 2, and it's called pooled saliva testing. This particular test allows us to scale up our testing very significantly. Our goal is to scale it up almost tenfold. And so we are going to be running that test side by side next week, getting all of the details worked out. And as we get it fully operational, we will then be actually increasing our testing even more. And so we're very excited to have this new technology that is developed by one of a team of our faculty, and they will be running all of the procedures and the testing in their labs here on campus. We will then be verifying any suspected positive cases with the PCR test. So we're very excited about this. And so we will be, like I said, we're actually starting next week to roll that out. So that really is an update on our testing and the different things that we're doing around that. And I would like to turn it over now to Mark Barker, who is one of the co-leads of our pandemic preparedness team, to share a little bit more with you. Mark?
Great. Thank you. We've got a bit of an echo. Yeah, great, thank you. Thank you, Provost Pedersen. I get very quickly to talk a little bit about the CSU pandemic preparedness team, and really it was a team that was seated very early in March of this year to start looking at how we address the pandemic as a campus and pulling in experts from across the campus. And the work has gone on all through summer since March to kind of get to the point where we are. You heard both President McConnell and Provost Pedersen talk about the resources that the campus has pulled together, and I get the real professional highlight of my career, I guess, as a student affairs guy to get to co-lead this team here on campus with somebody from our health network. We've also got, as you heard, contact tracers on campus that are working very, very closely with the Larimer County team. We've got, as you heard from Pedersen, our Provost Pedersen, we've got scientists and technologists from across campus that are working and advising us on testing strategy and modeling and data analytics. We've got experts from our facility management team working on airflow and water quality and all of those sorts of things. We've got student affairs professionals that are all part of our team helping with social norming, budget procurement. You heard Tom talk about from the county the importance of PPE, and so we share in that lift for our campus, and so we've got procurement folks that are helping with us. And I as I said, it's the highlight of my career, and we are working very hard as a team to try to meet the needs of our campus and our community and Larimer County. And I think with that, I will turn it back over to President McConnell.
Thank you very much, Mark. I really appreciate that, and thank you Provost Pedersen. I appreciate you briefing us on the research. We are very proud of the research that we're doing at CSU, but more significantly, we're very proud of the way that research is being used to help us keep the community and the campus as safe as possible to mitigate the transmission of the virus. I always say it's the best work of a land-grant university is when you can take the research and actually apply it and make a difference. And here we are. So thank you everyone for being here tonight. I'm going to turn it over to Amanda, who opened, because she is going to facilitate Q&A for us. And I know many of you have been writing in your questions. I think I see 7 on my screen. Perhaps there are more. But Amanda, I'm going to turn it back to you.
Thank you very much, President McConnell. So yes, we've got quite a few great questions. So I'm going to just kind of get us started since we have some already in the queue. This first one, I think, Tom, it might be one for you, and then maybe CSU might have some follow-up. But this first question is, what is the procedure in place for sorority fraternity houses when a case or cases of COVID-19 shows up in the house? 2 weeks ago, 3 cases were found in a sorority house. First, the girls who were directly affected and their roommates were told to leave the house, and then the house was locked down. Then a few days later, all the girls were asked to leave for 14 days. So what should have happened and what will happen if or when cases appear in sorority houses in the future? And what about out-of-state students? What should students do if they have an in-person class or lab that cannot be made up? So that might be the CSU part, but the initial part, since it's off campus, Tom, maybe you could help with that first part, and then maybe CSU might have some additional context.
Yes, thank you for the question. With the sororities and fraternities, that has been a challenge, and we appreciate all their compliance. When we do get a positive, that initiates the contact tracing, both with CSU and my staff. From there, we're going to determine what needs to be done. Now, it's really important that the isolation of those that are positive and are showing symptoms. And we want them to isolate in their room, their home, not out in the community. We've heard some cases of couch surfing. That now leads to more potential exposure. And then we want to make sure we get all the close contacts. And that close contact is within 6 feet for at least 10 to 15 minutes. And many of those cases that's going to be difficult to not have had. So there'll be quarantine, and we want to make sure they're quarantined within their home setting. Again, not out in the community. And from there, I know we're working closely with CSU on supporting the sororities and fraternities, because that is difficult if you are isolated or quarantined. So from there, that's really the contact tracing part. We really would like them to isolate and quarantine in place, but giving them the support and make sure they can do that adequately is the key next thing. So I'll turn that back over to President McConnell on that end of the following the question there with sororities and fraternities.
Thanks, Tom. I'm actually going to step in and talk a little bit about the process. As Tom said, the sororities and fraternities in the community are really an example of where the two forces between the two offices and contact tracing teams really come together. So we have worked through some very specific plans with them. We meet with them almost daily. Met with them today on the sorority and fraternity and Greek life quarantines and isolations. And really, it's about just coming together and being able to come up with a very comprehensive plan between the two entities. I can tell you that CSU, we've hosted community town halls with the leadership of those Greek units and their boards and the Greek councils. Early on, frankly, and Tom alluded to, there were some challenges early on. It was a very unique environment in that we had some questions about who really had the operational oversight over sorority and fraternities, and they are our students, and we have a huge responsibility to them, yet they don't live in our facilities, so we've had to work through some of that. have identified some pain points and frankly have identified, working with Tom's team, how to better address those things as we move forward.
Thank you, Mark. Thank you, Tom. So I think this next question is also probably going to be for our Larimer County Public Health partners. Can you speak to if the positive tests you're seeing are people who feel sick or are simply just testing positive? Also curious about the death rate versus case rate.
Yeah, Amanda, thank you. I'm going to turn that over to our medical director, Dr. Chris Urbina, to answer that question for us.
There we go. I usually make that mistake more than once in a Zoom meeting where I fail to unmute myself. So let me answer the first question. A case for it to be a positive case, it requires to have a PCR, which is a polymerase chain reaction, and CSU and their researchers, Provost Pedersen and their team, are working very closely with us to make accessible PCR testing. And that's the common nasal swab that you see out in the community, and it's available on the CSU campus. And so that's a positive case. The second piece of this question is about death rates versus case fatality rates. Death rates, this is simply when someone dies of a particular disease, as say it's a heart attack or COVID-19, that is compared to a population. So the death rate for heart disease is X number of people per 100,000 population. A case fatality rate is when you compare the number of positive the number of deaths in those cases over the number of cases. So it's I know that's very technical, but that the case fatality rate is often mistaken for a death rate, and it's not a death rate, and so they are different variables.
Thank you. And Dr. Urbina, while we still have you, we have a couple other additional questions around testing. So the first one is, are the different testing locations using the same source for tests, for example, as UC Health and the county sites doing the same, using the same kind of tests? And do we have a sense of the current rate of false negatives for the different tests available? Sure. And the other question is around whether you can take a test too soon after exposure that's less likely to capture the COVID virus. And are
sure, Amanda, those are all very good questions. So let me start with the last one first. Because, and Tom described this a little bit earlier, it takes anywhere from 2 to 14 days to show the infection. So that's the period of time that we call quarantine. So when somebody is exposed to the infection, not immediately, they don't come down with the infection. It takes 2 to 14 days. And so the average infection is around 5 to 7 days. So when you think about that in terms of its infectivity, you don't want to get the tests too early because you may not show any of the evidence of the nucleic acid in your respiratory system, in your nasal swab, in your oral cavity, or in this future test, the saliva test. You're not able to completely show that the test is positive. So we recommend 7 days after you've been exposed is the usual period of time, or if you had contact, as we talked about a little bit earlier. Remind me again what the second question was? Oh, the variability of the testing. Because this is a novel virus, and I think people are beginning to understand this now, is that we had a plethora of testing. Multiple pharmaceutical companies, multiple laboratories were producing these incredible number of tests, and they're all on different platforms. And without getting a whole lot of technical, and Dr. Pedersen would be probably able to describe this a lot better than me because I'm not a research scientist, but there are multiple platforms to test for this nucleic acid. And CSU is doing a lot of this research, and I applaud them for doing that. But there's such variability in platforms. We do not know exactly what those false positives and false negative tests. Because the PCR test requires amplification of the nucleic acid. And you probably have heard this cycle time that people talk about. We have chosen a very high level of cycle thresholds to try to make sure that in this dangerous disease called COVID-19, we can pick up as much of that nucleic acid that is there and present. So we probably, that's called a very sensitive test. So we probably overestimate the number of positives. But I'd rather have a false positive. And that rate is still pretty low, but I'd rather have a false positive than a false negative. So now let's talk a little bit about negativity tests, false negative tests. Because there's so many different platforms and so many different tests, the range, the false negative range is from about 5 to 40%. So I know that's a little scary to think about, but that's because of the variability of the testing and the procedure and the variability of the virus within the person. There is that range period. So if you have a positive test, you can pretty much count on that it's a positive test. But if it's a negative test, well, then we probably would want to test you again because the test is not perfect. And so that many doctors will say, if you have symptoms, if you have contact with somebody, then we're probably, and this we see this in a lot of in long-term care facilities. If they have symptoms, they have a contact, we may test them multiple times to make sure that they are truly negative. And I know Dr. Pedersen has been working a lot with our long-term care facilities to make that happen. That may not necessarily apply to college students and college campuses, but I think this research, because this is a new virus, we're going to learn more about the natural history of this but that PCR test that we talked about is currently our best diagnostic tool. One other comment, and hopefully I didn't confuse all of you, is this new antigen testing that we're talking about. So that is not a perfect test, but it's a good screening tool. And the wastewater treatment microsurveillance that Dr. Patterson talked about earlier and the new saliva test that they're developing are also surveillance tools. So if you get a positive saliva test or a positive sample in the stool, it really requires you to actually test more people because we really want to make sure they have a positive PCR test before we call them a positive case. I hope that helps, and I certainly, I hope I didn't confuse anybody, but there's a lot of technicalities there that are subtle in how we decide whether or not there's a case and the platforms around the testing itself.
Thank you very much. Appreciate that. Kelly, I'm going to go to you for this next question. This one is about MAX and public transit in Fort Collins, and that people might be crammed into buses, and perhaps there might be some air circulation that's inconsistent. Can you speak a little bit to what transport is doing around COVID protection?
Yeah, absolutely. Thanks, Amanda. So public safety on our transit system is something that's really important to us. The first thing that I would say is requiring facial coverings is 100% requirement on transit. So in order to board any of the buses, MAX, that is a requirement. We're overall seeing a pretty significant decrease in ridership. So overall, transit ridership is down anywhere between 65 and 75% right now, including on the MAX system. So that helps a little bit in terms of just people having more space. And yet I recognize those are average numbers, and certainly at any given time or on any route, there may be more people. So again, number one thing, facial covering. We've increased our cleaning protocols on the buses. That's happening more frequently. In terms of the air handling, the air turns over about 6 to 7 times per hour in those systems when the HVAC system is running. So those are some of the things we're doing. And then I'll just acknowledge that, we're really looking for what are best practices out there and continuing to evaluate the research. So far, it's showing that it's really a pretty low risk as long as people are wearing their facial coverings, in part because of good air quality and in part because trips are generally pretty short. So those things are working in our favor. But that's something we'll continue to look into and pay attention to as hopefully ridership starts to build back up in the colder months.
Thanks, Kelly. So for the next question, Mary, we're going to go to you. And this question is around the cycle of testing that you spoke of for the dorms and whether or not that testing is mandatory. And if so, how is non-compliance managed?
So when we request a dorm to test, we do indicate that it is mandatory because we want to be sure that we're capturing as many of the students as we can. Most recently, when we had the 2 dorms that were entirely on quarantine, as of today, we've had 82% in one of them and 80% in the other tested. And what we're actually doing is identifying the remaining 18 to 20% by name, reaching out to them, texting them, and creating quite an aggressive campaign to directly contact them to get them tested. So we feel very strongly, and we are actually, one of the things that we're working on is trying to determine how to get that to almost 100%. So yes, it is. And we're also hoping once we start moving to the saliva test, which literally the students will be cooling their saliva and just spitting into a tube. And they all know that this is going to be on a regular cadence. And we're creating a social norming campaign around that right now, that they will all be realizing this is just the normal part of being able to stay here on campus. And so we're also trying to create that real strong expectation that they will be doing this frequently now as we go through the rest of fall semester.
Thanks, Mary. And we have a couple of other questions kind of related to the dorm quarantine that perhaps you or someone else from CSU might want to answer. One was really just about the most recent quarantine that where some students were released basically in a few days, 3 to 5 days, and others may have been told that they were going to have to quarantine for longer. And then there was a question here around just, if there are students not complying, is it possible that perhaps the quarantine was lifted too soon? So just, if you wouldn't mind just kind of sharing a little bit more about the approach with the most recent cases in the 2 residence halls.
Yeah, thank you, Amanda. I will. I'll kind of address I actually will address what happened with the dorms and the quarantines. To start, we utilized the word quarantine so that the students in those dorms would understand the importance of what we were asking them to do. The county did not issue a quarantine order for those students, nor did our public health office. It was frankly a shelter in place, so there was no official quarantine order that would have carried a 14-day requirement for them to stay in the dorm. That action was taken specifically based off of wastewater signals, so that we could then test students. We tested, and forgive me, I don't have the number, but over the weekend immediately after that action was taken, we tested a number of students, identified positives, identified close contacts. We were able to transition those out of the dorms, and then retested wastewater, saw signals drop that were an indication to us that it was safe to then go ahead and let those students enter back into their daily activities without the restriction of staying in the dorm. The other thing that we did is we knew that we had prior positives within the last 90 days that were housed in those 2 dorms. So we set up a process very quickly to identify those so that we didn't get them into our retesting population and allowed them to move out as well very quickly.
Thank you, Mark. This next question will probably be for our county health partners. And this is around, how many deaths in the last 6 months were from nursing homes, and that it seems that the majority of deaths are in 80-plus-year-old community members. So the question is, why are you asking healthy people to mask and social distance when the majority are older folks in our population?
Yeah, excellent question. Thank you. And I do want to give a really shout out today. It's our first day that all of our skilled nursing homes, we do not have an outbreak in Larimer County. As you recall, back on March 9th, we were the first to have an outbreak, and this is devastating. Out of our 53 deaths, just over half have come from our skilled nursing homes. This virus, and I'll turn it over to Dr. Urbina here in a minute, he can give you the medical side of it. It seems to very much attack our elderly and those with underlying health conditions, especially heart disease, lung, asthma, or diabetes. So it's very devastating and very challenging in those environments. I just give a big hats off to all our skilled nursing frontline workers, healthcare providers, and our staff working so hard since March to stop all the outbreaks. And today, we didn't have one outbreak. And that's a tribute to the hard work going on. But the biggest problem with COVID-19, the virus itself, is this asymptomatic or pre-symptomatic spread through the respiratory droplets. And that has been the biggest issue. And that was the reason why back in May, I did issue a face covering order. It was a very difficult decision, but we could not continue to have this asymptomatic spread in our community. Somebody feeling they're healthy, they're fine, but they possibly are spreading the virus through those respiratory droplets, then impacting those more vulnerable, those of age and those that may have those underlying health conditions. As soon as we issued the mask order, our rates completely started plummeting down to where on June 13th, we didn't have anybody being treated in our hospital. That's another success we had here in Larimer County. Much of that work is preventative. I know it's a pain. I know it. But all these measures that we're taking are keeping our rate lower and our deaths lower. We lost 53 souls. That's tragic. But when we look at other comparative sized counties, we're in a much different place because here in Larimer, we've taken these swift actions, wearing face coverings, washing our hands, staying 6 feet apart, maintaining small groups or no large gatherings at all. That has kept the numbers down. And that's why this virus is very different than other viruses due to that asymptomatic spread. And with that, I'll turn it over to Dr. Urbina to add more to that from a medical standpoint.
Sure. Thank you, Tom. And this actually allows me to kind of bridge the gap between the questions, hopefully. As Tom alluded to, this is a novel infection. It's primarily spread by respiratory droplets, although it can be aerosolized. So it can be spread farther than we think 6 feet. But by wearing a mask, physical distancing, all the things that Tom talked about earlier, we can reduce the spread from person to person. Now, it is true that younger people, particularly college-age students and younger, are primarily asymptomatic. That doesn't mean that they don't develop symptoms or long-term sequelae, because again, this is a new virus and we don't quite know the complete natural history of this disease. We're learning daily about how it's spread from person to person, as well as how it's spread, how it actually presents in the human body. There are cases in children of this multi-system inflammatory complex that is very serious and can be deadly. So every person presents slightly differently. So the question earlier that someone asked about, can somebody be positive and be asymptomatic? The answer is yes. So that's why the microsurveillance, not only in the saliva as well as in the wastewater, is important, because many people may be walking around with the infection and not know it. And then we can, as Mark alluded to earlier, then we can go out and test them. They're not necessarily infected, and they don't need to be they don't need to be isolated until we test them. And if they're positive, they become isolated. And if they have contacts to that positive person, then they become quarantined. So I think that quarantine means that you had a close contact with individuals. So I think I'm trying to connect the dots between the questions, and I think it's important for folks to understand that the public health orders are about stopping the spread of the infection. And the isolation and the quarantine and the testing go hand in hand, so then we can put in place effective mitigation strategies to stop the spread of the virus. So as we move towards a vaccine, hopefully that will help us tremendous, so we can immunize people against this infection everybody's susceptible. Everybody is susceptible. The older folks that Tom talked about, and I fall into that older folk category, is that because of our age as well, and if we have heart disease, lung disease, those chronic conditions that people talk about, that makes us more vulnerable to the complications of the infection. So you see in young people that are healthy, they may be asymptomatic, or they may have mild symptoms, and older folks like myself, or may have chronic conditions, we may actually die. And I think Tom stated that well earlier, and hopefully I've connected those dots and answered some of the other questions in the box.
You did, Dr. Urbina. What I just want to add is when you're wearing a face covering, you're protecting your neighbor. You're protecting those around you, not yourself for the most part. This research shows you're protecting you. So when I wear a face covering out in public, I may have it. I may be asymptomatic or pre-symptomatic. I'm protecting all those around me. And when I'm in the grocery store, I don't know who's vulnerable to the virus and who's not.
Thank you very much. Appreciate that answer. So the next question will be for our CSU partners, and this is around the CSU dashboard. And the question is, why is it not more regularly updated with info on CSU's total testing numbers, total testing positives, and percent positivity?
I'm happy to take that question. There are several different sections of our COVID reporting, and there is a actual dashboard, and it's titled Current University COVID-19 Cases Per Day, and it's updated after every testing cycle. So if someone gets on the website, they should go to the actual chart, and it shows lines per day, per test, and it shows you in dark green the number of students who've tested positive, and in light green the number of faculty or staff who have tested positive. It also shows below that in cumulative cases the total number compared to the Larimer County total number, and then it shows the Colorado numbers, and it gives an explanation of the cumulative cases. The thing that I think is important for people to understand is that this is the daily dashboard. It will be updated every time we get the test results. So for example, we got the test results from the last round of testing on 9/29. So 2 days have gone by, we haven't updated it because we haven't had another test result come in yet. So it's always important. It's usually on a cycle of a 2 or 3 day cycle. And if you move your cursor across the chart, it will show you the exact day, the number of students, and the number of faculty. The other thing I'd like to point out is the total total or cumulative cases actually date back from May. And so if someone wants to understand what's happened between the day students moved in and now, the day that students moved in was August 17th. So you need to move your cursor to August 17th. You'll see when we started to test. You'll see the numbers for each testing cycle up until today. I hope that's helpful. Yeah, the narrative portions are updated as we make announcements or release or have releases, but this dashboard is always going to be the absolute most up-to-date data that we have. So thank you. I also, while I'm on here, I understand looking at the Q&A that someone has asked about what to do if they see gatherings of students, groups of students who are unmasked, what to do. And we do have a safety site. Anyone can report a gathering at that safety site. So just go to the CSU website, look for the safety site, go in and register your concern, where it was, when it was, how many students. That'll be very helpful to us. And then you can also report in on the CSU Daily Symptom Checker. It gives you an opportunity to report a gathering or any issues that you see. So I recommend that you report in those two places. Those are monitored daily, so we'll be able to get your information. Your information will get to us, and we'll be able to find out what we can do about it. I really appreciate everyone's deep concern. It's very helpful for us always to have eyes on the street. So any information you have, please report it.
Thank you, President McConnell. So I think we're close to time. We might have time for one more question. And I know we have a lot more in the queue. So thank you all for all of the thoughtful questions. And we'll be sure that these questions get shared with our panelists too, so that as we're communicating in the future, we have a sense of what's on folks' minds. So this last question is probably for our county and possibly city as well. We heard today about the wastewater early indicators that we're able to help at CSU. Does the city or county have any plans to test wastewater citywide?
Great question, and yes, through Dr. Urbina's great work and with the Colorado State University and the Colorado Department of Public Health and Environment, City of Fort Collins, Town of Estes Park, City of Loveland, and the Town of Wellington are all participating in this project. We're excited because we've almost got the whole county covered when it comes to the wastewater testing. Dr. Urbina, if you have anything else to add, but yes, we're excited about using this technology as an early warning indicator.
No, I think our leadership at CSU has really helped us a lot. I think it's going to be a useful tool in the future. And so we're looking forward to sharing those results as we start to collect more samples.
Wonderful. Thank you very much. So with just about a minute left, I would just love to turn to our panelists to see if anyone has any final closing remarks that they'd like to share before we wrap up this evening.
Amanda, I'll just say thank you to both Tom and Dr. McConnell, as well as our other panelists, for the great dialogue, and to everyone who submitted questions. I really appreciated the interest from the community, and again, the collaboration and partnership amongst the entities. So thank you all.
I want to echo exactly what Kelly said. I'm feel so fortunate to have such good partners in the city and county, and together, and you heard that we do work together several times a day. We are making a difference, and that's makes us feel very good about what we're able to do together. And that includes all of you. So thank you for participating. And I hope we get to do this again.
Well, thank you all so much for being here this evening. And yes, we look forward to doing it again. And I hope everyone has a lovely night. Thanks so much, everybody.
Good evening, everyone. I'm Lee Thielen, and I'm from the League of Women Voters to Larimer County. And on behalf of the City of Fort Collins and the League of Women Voters of Larimer County, I'd like to welcome you to this forum for candidates tonight. We're going to hear from candidates for District Attorney first, and then we will hear from the candidates for County Commissioner for Larimer County. I'm joined tonight with my good friend Sherry Stevens, who is going to be keeping our timekeeper, and she will keep us from getting in trouble and going over time. This forum is being live streamed, so you know that. And it's tonight on Fort Collins TV. Those are channels 14 and 881. In addition, it can be followed online at fcgov.com And I think that's a /FCTV. And it will be, later in the week, will be put on the League of Women Voters of Larimer County's website. Not tonight, but a few days later. And I'd like to give a big thank you to the City of Fort Collins and the good folks that work here for providing this opportunity to present the candidate forum. As the moderator, I'll be posing questions to the candidates. Questions were solicited from the public and also from members of the League. And each candidate will have 1 minute to answer a question. In order to keep on time and allow all the candidates time to share their views, we will be strictly adhering to that time limit. We will open with introductory remarks from each candidate, and we will end with closing remarks from each candidate. Just a reminder, the League of Women Voters is a nonpartisan organization. We do not endorse or oppose any candidate. We do take positions on some issues, but only after extensive study of that issue. By the way, men are always welcome. The League is not just for women. Some of our most active members, indeed, are men, and we love it when they join. By the way, we're just so pleased that these candidates have agreed to join with us today. We're going to start by letting them introduce themselves. And again, they will, for the opening remarks, they will be limiting themselves to 1.5 minutes.